Greetings, class. This is Professor Pat, and we are now into week 15, covering chapter 16, the integumentary system. The integumentary, and notice the spelling, it is A-R-Y, integumentary, not E-R-Y. It's one of your spelling words on the test. Includes the skin and then the accessory structures. And the accessory structures include the hair, the nails, and the glands. And you'll notice there's two types. We have sebaceous glands, which we're all familiar with because it's always little areas of your body that seem a little oilier than others places, and sweat glands. The skin is, there's two combining forms for that, dermo and dermato. And the you'll be familiar which combining form to use as you build words and start using them. Like you say dermatitis, so there's the D-E-R-M-A-T part, or you have the, just like saying a dermatome, which is the instrument for cutting the skin. When they do skin grafts, they have to have it that shaves off a very thin layer of tissue to put over an open wound. So the epidermis is the top thin layer, epi meaning upon, so that should help you remember that. Then the dermis is the middle layer, and that's where contains all the collagen. And today with the cosmetic industry and science going crazy on how to keep everybody looking young forever, we lose the collagen as we age, and so then that's why we start getting the lines, the wrinkles, and actually I recall years ago hearing some scientists say from the age of 21 until you die, you're on the downhill slope, and that it just seems so unreal because 21, so many of you are just waking up and realizing that, oh, you are in charge of your life. But at any rate, the collagen is a really good thing, and so a lot of our cosmetic products now have that collagen substance, so they things to stimulate the improvement or the growth of the collagen. So the dermis is that dense fibrous connective tissue. Okay. The subcutaneous, we know sub meaning below, so that's the bottom layer, and that's the layer that has the fat in it that gives you that nice complexion. Everything together works. But if you have any issues with any of these areas of the skin, then we all know that there's times you break out, we have acne, and we'll learn about these conditions as we progress. But there's the skin. Now the accessory organs are the hair, the nails, and the glands. Then I want to point you to vocabulary. So if you're on page 655, the 9th edition, or 631 if you're in the 8th edition, there's just a few that you need that I'm going to focus on because you learn the combining forms. And a lot of these words will also have the term for the condition of that structure is in the chapter. Albino is the pigment, or a person who is deficient with the pigment melanin in the skin, and so they are very pale, very white. But also you have this, the hair is white, the eyes white. They don't have the color. They usually the iris is kind of reddish, but they're just very, very pale. Okay, they lack the pigment. Lipocyte is the same thing as an adipocyte. There's the fat cells. And then we have melanin, which is the pigment that gives the skin color. And we always admire people that have that sort of more pigment, melanin in their tissue, because they look, we always say a tan makes you look healthier, because we know that people that are very fair complexion, the skin is very white, loose, it's like you look anemic. Okay, so that's why people always want to get the tan, but we know that the getting out in the sun is now not good because we're getting more and more cases of melanomas, and that's one of the worst cancers you can have. Sebaceous gland is the oil-secreting gland that's in the dermis and associated with the hair follicle. So one of the things when you brush your hair, some of you are from cultures. I know when I was young, they said you should brush your hair like 100 times a day. So that, and what you do, is that brings that oil into the down through the hair substance so that it gives it kind of a shine. There's some of you that you shampoo your hair every day, and that makes it more oily. And you say, well, I have to shampoo because it's so oily. Well, every time you do that, and that stimulation of the scalp, etc., stimulates the secretion of the sebaceous gland. So there's the oil in there. Sebum is the oily substance that is secreted by the sebaceous gland. And we'll say, think when you have like a cyst, a sebaceous cyst. It's the sebaceous cyst. We know the cyst is a sac. Is where the gland fills up and is plugged, and it doesn't get out. So the sebaceous glands can, have issues where they're plugged, and then you have a sebaceous cyst, and they must get that sac out to get rid of all of that, okay, or it just fills up again. The combining forms and the art start on page 656, but at the bottom, I want to bring you to the page, you have the colors. So now you're going to learn the word for the colors, and they use these terms in describing the appearance of the skin. So this is we'll go through the word parts, but I want to draw your attention to that, and then look at the terminology, because it's that terminology that's going to be on the test itself. Okay. White is albino and leuco. We already had leuco, but we see that leuco we use for the conditions such as the white patches, leukoderma, and where the white patches on the skin are acquired. Just like all of a sudden it's like the melanin leaves that area for whatever reason. Leukoplakia is the development of mucus on the mucous membranes, but is that whitish. It's like it's usually a postmenopausal symptom, because it's like you lose the vascular, I think, capability, so that in the vaginal vault, then it's like usually a deficiency of estrogen that also is responsible, because they give the vaginal estrogen cream to have healthy vaginal tissue and components. So anyway, there's the leuco for white, you already know. Leukoderma is the white patches, and leukoplakia is what develops on the mucous membrane. Okay. I already mentioned on the albino. Okay, let's go to the next one. So blue is I'm going through your color thing, so you can hear it. Cyano. Cyanosis is, we already know, that's a deficiency of oxygen. So that when you have that deficiency of oxygen, and oxygen, it's like the hemoglobin is what carries the oxygen. It makes the skin, and you lack that, it makes the skin kind of that bluish tinge, just like jumping in the cold water. Your lips kind of turn bluish, your skin gets blue. You know what the look, I'm sure all of you know what that looks like to some degree. For red, erythro and erythrocyte, red cell, you know that one. Rosy, you associate with dawn. Rosy or dawn colored is the combining form is eosino, and we've had eosinophil, the one the white cell. Whoops, that's a misspelling. The eosinophil is the one that Phil is attraction to, that dye, the eosinophil that gives the color in the cytoplasm. Green is chlorophyll. We think of the leaf, phylum is leaf, so chlorophyll, so that's a green leaf. Then yellow, you have Jondo and Ludio. Jondo, we think this is what most of you associate with, because when people have liver disease and you get jaundice, it's also known, and that's that AKA for those of you that have not heard that abbreviation used, also known as. Jaundice, the doctor may just say the icterus index, and that's how it's stated in your pathology section of your book. And they equate the skin coloring to the severity of the disease. Okay, so when you have liver disease, hepatitis, you get the jaundice, so that's where that comes from. But it's also then caused by hyperbilirubinemia that you see the babies get, and they put them in the sunlight to cure that. The other combining form for yellow is luteal, and associate that with the corpus luteum, which is the name for the empty ovarian follicle. Tawny is like an orange yellow. Those of you that are art students, some of these are, you're very aware of these little details to variations of colors. So the tawny yellow, orange, either the orange yellow, we see in cirrhosis, and we had that. Notice the spelling of cirrhosis, C-I-R-R-H-O-S-I-S. So, and that was referred to back in Chapter 5. It can be due to alcoholism, but often is due to malnutrition or hepatitis. For gray is polio. So refers to the gray matter of the nervous system. And here's poliomyelitis, inflammation of the gray matter of the spinal, the brain of the spinal cord. It's all that that whole structure. Black anthracite. For cholanthracosis, that's a condition. Remember that black lung disease, the coal miner's disease, anthracosis. This just keep saying these things over. This is review, and that's what you're going to see in the final. So you're preparing for the final, and you've been doing that since day one. So give yourself some credit and applaud your continued efforts here. Melano, which is we see in the type of cell, melanocytes, and that's where we get the melanoma, the mass or tumor of involving the melanocytes. And melanomas are, very, very dangerous. They're very potent because they spread via the lymphatics. You see, adipose or fat. Now I'm going to go down through the combining forms. So we're starting there at the top of page 56. Oh, I did the typo there, didn't I? Oh, I was in a hurry. Adipose for fats. You have adipose, O's means full of, so adipose tissue, the fatty layer. Lipo is fat and lipids. Lipoma is a fatty tumor or a fatty mass. And it's just like you get little bubble pops up on somewhere in your body, and say, well, there's a little lipoma, just a little benign fatty tissue collection of fatty tissue. Steato for fat, and this is in the conditions. Steatoma, which is the same as a lipoma, but you have steatorrhea. We had that in Chapter 5, which is where there's fat in the feces because there's improper fat, digestive breakdown of the fats in the digestive system. Caso, meaning burning, you saw that in Chapter 10. So it's used for condition. Causalgia, it's a burning pain. Now, cautero means burn or burning, and it's used in procedures. So you have electrocautery in general surgery, but they can also do this in dermatology. It's like they have this machine they call a BOVIE, B-O-V-I-E, but it's able to coagulate blood vessels, bleeders when they cut through, but they can use that the electrocautery unit to cut through. It's like they burn their way through, so it's less bleeding. So on superficial kind of areas, and they'll use this. I mean, so when I say superficial, it's like, right in those fatty, the subcutaneous dermis, or the even subcutaneous layers. And you will see electrocautery sometimes in dermatology. And the other form of that would be like past tense. They cauterize. They're going to cauterize the lesion, so they're going to burn it. Now, but there's another one called desiccation, which is using a needle to do that. We'll get to that in a minute, so I don't want to jump ahead to that. So here it is brought up the next thing, electrocautery versus desiccation. So for cautery, meaning heat or burn, desico is drying. So you think of, I always think it dries up something by applying the heat. So the difference being is the instrument and how it's used. The cautery is a flat blade that burns through, but desiccation, they use a needle, and it's just like a little spark to dry up the lesion. And then they follow it by using a curette. And a curette is like, it's a miniature little spoon thing that just scrapes. If any of you have ever got a dermatology and had to remove any keratoses or calluses, they probably did some desiccation and some scraping. So that's those terms. Cutaneal for skin, and of course we have dermal and dermato. Cutaneal is the anatomical reference. So you're going to see when they'll only talk about it in a general way of saying the subcutaneous layer or the cutaneous structure. It's just anatomical. But if you're talking about a condition or procedure, then you're going to use the dermato. So you have dermabrasion. So we drop the O because abrasion means wearing away. For anybody that's had a severe case of acne, you may have seen something. They have an instrument that has a rotary, kind of with a diamond blade, and they just gently rub that on the skin, and it just kind of wears down the rough edges. So it's like people have had a full-blown case of acne vulgaris in their youth, and then they get older and they have all these pock marks because their girlfriend or their mother or themselves always pinch these pimples, and it traumatized the skin. So it heals, and you've got these little pits. So that they can correct that, and the procedure to do that is the dermabrasion. So there's more and more things becoming available over the, like they say, over the counter. So there's that, what is it? There's a sonic thing where you do for skin cleansing and abrasions on the skin and has good skin. Well, that's not quite as invasive or as the dermabrasion. Dermabrasion done by a surgeon, plastic surgeon. Or a dermatologist. Okay, so that's it. So that's condition. Dermato, then you have here dermatitis, inflammation of the skin, or dermatologist procedures of the specialty within that. Okay. Diaphoral for profuse sweating. We know that perspiration is sweating, but people that have excessive sweating, and it's really what it will say is when they're sick, like the flu. Some you have a serious case of flu, or you have some kind of disease that's generalized throughout the body, and you have high fevers. All this, you break out in a sweat, and you wake up and your pajamas are wet, the sheets are wet. Your body just it's just profuse. So they use this term explaining the severity of the condition. So they'll say that the patient is diaphoretic. So that it means that they're just just breaking out in a sweat because the body's trying to maintain homeostasis. When you have a high fever, it's going to try to break that, and you break out in this sweat thing. It tries to cool the body down. Or you have the diaphoresis. So these are all, the only difference is in the tense. There's past tense or the condition here. Erythemo it's like saying erythema, but it's redness. Erythema is the condition. Blushing. When somebody blushes, it's like the little capillaries, I mean, they just seem to dilate, and the blood, it's a nervous condition. Those may say nervous, it's not a serious condition, but some of you just are just shy. You'll say, oh, they blush. Then you see the skin gets that flushed, red kind of flushed look. Okay. Erythemato is also the redness that you have here. Erythematous, which is the adjective form. So erythema would be the noun, and this is causing so the erythematous condition causes erythema. Hydro. Notice the H-I-D-R-O versus H-Y-D-R-O. Hydro is water, but H-I-D-R-O is sweat. It is normal to perspire. And when you perspire, you sweat. I mean, sweat sucks, say the slang, but that's the term. Excuse me. So anhydrosis, ans mean no or not. So somebody who lacks the sweat glands or lacks the ability to perspire, they can't sweat, condition is called anhydrosis. This is serious because remember, your body wants to maintain homeostasis, so it needs all these things to. If you're too hot, you perspire and you cool off, and and if they they have another challenge though with that. I don't know all the specifics, but it's not a real common problem you see, but you will hear people that have that. The opposite of anhydrosis is hyperhidrosis. Hyper means somebody who sweats excessively, and this is when you're like working out. Some of you just really perspire. But don't confuse it so much with the one we just had with the diaphoretic. Because diaphoresis, I always think with a disease condition, and hyperhidrosis, they might use them interchangeably, but more often hyperhidrosis is somebody that when you work out, for some of you, you look at guys, I mean, they work out and their clothes are wringing wet afterwards, so because they just produce a lot of body heat from that activity. Ichthyo. Notice the spelling. This is one of the spelling words, ichthyosis. I-C-H-T-H-Y. And ichthyo means scaly or dry, but it is a serious form of dryness. So, so the next term is xero, X-E-R-O, xero for dry, xeroderma. So xeroderma is a mild form of dry skin. Ichthyosis is a really severe, full-blown case, and the skin is it's like, it's very rough, and it's thick. The outer side layers, it is an abnormal condition. People that have that usually don't have occupations where they have to deal with the public face-to-face on a continual basis all day long, because some people get very grossed out when they see somebody that has all these very, it's like trying to, even some of the, it's a normal thing for some of these animals because they walk on their feet and their hand, but that's very heavy structure. I wish they had a good visual. They have a picture on page 658, that ichthyosis, but you kind of get an idea. It's just very thick. You see the skin's cracked, etc. Okay. Xeroderma, the dry skin. We get this as you age because you lose a lot of the, the sebaceous activity, so that keeps your skin moist. So as you get older, you get lotion, or those of you in a certain occupation like hairdressers, I would imagine a lot of the cosmetologists stuff, their hands are in water all the time, and they're in a solution, so you're putting a lotion on your hands every time you wash just to keep the moisture in there, and that's a good thing. as it helps keep skin. And remember, your skin is your main line of defense. When you have unbroken skin, those of you in nursing and medical assisting, any of these clinical areas, it's just, you don't even want, you have a paper cut. You don't want any open areas on the skin because that makes it entrance for the bacteria. So that's why you put lotion. If your hands are in water a lot, you must lotion a lot and keep them moist and healthy. Okay. Keratosis for hard, horny tissue, and here's keratosis. An example of keratosis would be warts or calluses. Those of you that go barefoot or even wear like sometimes the flip-flops, it's like you build up calluses around the periphery of your feet or even on the soles of your feet. And if people that work in the construction, like in bricklayers, they're handling that, the cement and the brick and all that hard stuff. So their hands get dry, and they'll also get these fissures. The fissures are cracks, remember, in the skin. So they use really a more like Vaseline, something more effective. There's a lot of oil in it. There's also I think called there's balm, sort of things like BALM, balm. They use it on cows because when the milking cows, their teeth that get very hard and cracked and it's painful. So they use that cream on them as well. And I know there's some people go to the farm stores or that only handle stuff for the animals and get that balm. It's in a green can. I forget the name of it, but it's very prominent and very effective because it is has a high oil content to it. But it's like goat's milk. They make soap out of goat's milk, and that also has a lot of lanolin in it, and it's very good to keep for your body lubricated, so healthy, soft. So here's then there are also many types of, we say, keratotic lesions. In your book you have a good diagram that shows it. But keratoses are things, also you get the tiny ones. It's being out in the sun for in your youth. As you get older, all of a sudden you start seeing these little thickened areas pop up on your skin, and it's this you can kind of scrape it. It's very nice. Well, that's the example of a keratosis, and they can burn them off if you want to. But then they can change color and they get kind of ugly. But they just burn them off. There's nothing really to worry about. Myco is for the fungus, and you have such a good visual on page 659. On the left of foot, you have athlete's foot. The mycosis is a condition of fungus, so it includes the yeast, molds, and and mushrooms. And the examples we have here, there's tinea pedis, pedis for foot. So this is tinea pedis is another name for athlete's foot. And they call it athlete's foot because I think your feet sweat, and then it's bacteria gets in it because it likes the warmth and the moisture. Yes, some of you are more prone to this than others. The thing that for any type of fungus, it's like soak your feet. You think it's like getting the fungal infections in your fingernails, toenails. You soak them in vinegar. Just to put put a pan of water so that you can get your foot in. So it's like maybe an inch and a half, 2 inches deep. That you're going to put your foot in, and then you put maybe half a cup of vinegar. It doesn't matter if it's white vinegar or apple cider vinegar, but vinegar will eliminate and cure the athlete's foot. Also eliminate and cure the fungal infection you get in the nails. Those of you get your nails done, and sometimes you pick up a fungus from the shop, or you get old water. You get those artificial nails, and then you work in an occupation that your hands are in water a lot, and then once that fungus gets under it, it's happy, and it's going to stay under there. So they can do they do laser on it, but that's expensive. But your at-home remedy is just you could put some white vinegar in a spray bottle and spritz it on your nails, spritz it on your feet, and soak it, and it will clear it up. Doesn't do it overnight, but it does get it. So tinea corporis is ringworm, and corporal meaning for the body. So the ringworm is a fungus. You know, kids get this from playing in the dirt. This stuff, this fungus in there. They get it from each other, and you have a picture of a child with the impetigo, which is very similar to the the ringworm thing. And on page 661. Okay. Phyto, for the plant, dermatophytosis, just the name for the athlete's foot, and it's the fungus infection. Dermatophytosis and dermatomycosis are the same, phyto being plant. Onycho and unguo are the combining forms for nail. Onycho is used for all the conditions. And unguo is for the anatomical reference. So they will say the splinter was, subungually located, or was under the nail, whatever you got in under the nail. Onycho then is for the condition. So onychomycosis is a fungal infection involving the nail. And here's one for those people, people that bite their fingernails. They're onychophagiacs, or we say onychophagia, the ones that has the habit of biting the nails, and how it's used. So onycho for nail, for conditions, unguo, nail, and anatomical reference. Pyo for pus. Pyoderma is any purulent, again notice the spelling, purulent, P-U-R-U-L-E-N-T. We're going to have a term shortly that's like pruritus, P-R-U-R. So you have to be able to say it, but purulent, purulent is the pus on the skin. Pyoschisia would be pus in the stool. We had hematoschisia in the chapter 5, which was blood in the stool. Well, there's now pus, which means there's some kind of bacterial infection in the intestinal tract, the lower end of the intestinal tract. Pyogenic is genesis mean origin, so pertaining to producing pus. So it's pyogenic. We'll say they're pyogenic organisms. I mean, some organisms will cause the bacteria to form, and then you have the pus comes out. Rhytido for wrinkle. This is going to be on the final. Those of you who are stressing. I was on the test, but here you have rhytidectomy, facelift. With this, our society so gung-ho about preserving the youthful appearance, and I'm all for looking good. But that's the proper name for facelift is rhytidectomy. And now there's many types. They do injections to fill it. They just put the filler because you've lost the collagen. That just kind of puts it in, but that's not permanent. You have to have it done every few months to and maintain that, and it gets rather costly. But if it's somebody, it doesn't really cure all. So people that are really wrinkly need to have a rhytidectomy to get rid of all the excessive skin that sags, and then they press it, suture it, and you look good. But you don't want it so expensive that it pulled. And these people that get umpteen facelifts, one after the other, I mean, they're just always their obsession. They're goofy. They're just ruining. They don't ever look like they did when they're younger, and they're usually unhappy because they ask to have too much removed. So they're having to come just to get the excess. But there's also that life lift. I've heard pros and cons about that. Some people they say if it doesn't, if any of it's just sutures. All they're doing is suturing the muscle back into position, and if that suture gets becomes tied, whatever the knots and how they secure it, or it absorbs or whatever, then you've got a sagging side, one of your side of your face is sagging. So it's listen. Don't just run to judgment and go listen to all the things and know who you're going to, and are they board certified? Do they really know what they're doing? And I'd give some references. SIBO for sebum, which is the oily secretion, and here's seborrhea, which is the discharge of the sebum, and the medical term for dandruff is seborrheic dermatitis. And dandruff is really, most of it is because it's a dryingness, but people don't rinse, they shampoo their hair every day, but don't rinse all the shampoo out, and that also dries and it gives it, a flaky. So there's stuff for that. So there's your, for seborrheic dermatitis, dandruff. Now the cutaneous lesions, and you say your book is just full of them. And I'm going to go here on page 662. I didn't say all the terms here. Yeah, I can maybe. I'm just looking at the book. Since we did mycosis, and we had onychomycosis for fungal condition of the nail, in tricho for hair, TRICHO, there is trichomycosis. So the fungus gets into the hair follicles as well. Okay, lesion in the paragraph, right at the top, page 662 in the 9th edition. For those in the 8th, go to the pathology of this chapter, and it says cutaneous lesions, and right as a bold letter, lesion. And you need to know this. This is a test question. A lesion, let's say the lesion is just, in nursing you say this all the time, well, there's lesions or whatever, but it's like being very generic. So, but it's any discontinuity of tissue. It's damaged anywhere on the body. You'll say, well, there's a little lesion. It's something you don't want to identify it, whether it's an opened sore, not an ulcer, but there's cracks or growths, whatever. It's a lesion, any discontinuity of tissue. Now, crust, and now if you look on your pictures, now those are your visual, write the word in your picture so you get it, but you'll see that figure A. The nose, it's a crust. Crust is like saying there's a scab. If you've ever had a rug burn, those of you that are wrestlers or like rough house, the carpet, sometimes you can get, a rug burn. So there you see the crust is a scab, how it dries and closes over. Okay. A cyst is a closed sac. And we said, sebaceous cyst is because the gland is closed over and it's just overactive, and then that cheesy substance, which is the sebum, is filled in there. And, if they have a cut, it comes out. But the surgeon always wants to remove the sac in total so it doesn't fill up again. But they usually occur like around behind the ears. There's always, and sometimes you'll get them on the neck. Like when you have a sebaceous cyst someplace, it'll continually fill up if they don't get that whole sac out. But most of your oily areas. So a cyst is a closed sac. Well, there's a pilonidal cyst, and that is B picture. And you see that little reddened area. We used to call this the freshman's disease. When students went off to college, the universities, they have these huge lecture halls that seat 500 students or more. I mean, forget about talking to your professor, but it's usually a instructional assistant, or a teaching as a TA that presents a lot of the lectures at the university, because the university wants their professors to research and write books and all that, get known. But at any rate, they sat in these hard chairs, all day, going from lecture to lecture, but really it's just like a little defect that has been there, but it's all that sitting that kind of irritates it, finding that it comes to a head. So you'll see that in it. So it has hair in it, and they talk about the pollinology. It's found in the sacral area of the back. It contains hair, and that's the pilo, where that comes in, that word pilonidal. So it makes a little nest. Okay, so that's for that term. And we already talked about sebaceous. Now the fissure, we had this in chapter 5. The fissure is the groove or the crack-like sore. And we associate it most often with like the corner of your lips, and then that's when you have a cold sore. It, and it starts to heal, and then you smile, it breaks it open, and it hurts. So you're saying, oh, well, that's a little fissure. But you can have an anal fissure. You have a fissure just about, anywhere there's an opening. It can get irritated and open up. So it's just a break in the lining. Macule. And I'm going right down the list. The macules are flat. Of course, they show that fissure is on D, diagram D, if you're following along. It's like a paper cut. A macule is flat. Now, on the test, you're going to have things like an example, give an example, or matching. Well, a freckle is a macule. So look at that. Those of you who have freckles, you have macules. It's just another term. If tattoos, are macules. They're flat. Remember, it's a discontinuity. Okay, so it's a change in coloring, change in structure, whatever. The nodule is the next one on F, and you'll see there's kind of little elevations. And really, you're going to say, oh, how do I going to? There is a sequence. So you have the nodule, and then you have like a tumor. They're all in. It has to do with the size. So a nodule is a lesion. It's solid, but it's not greater than 1 centimeter. And you're thinking, oh, geez, centimeters. Well, there's let me see, 2.5 centimeters per inch, and there's 10 millimeters in a centimeter. And there you can, this is the other countries. Those that are from Russian, European countries, they all they know the metric system, so they have a good clue. We say 1/4 of an inch, and they that we use the other forms. So nodule is just a solid. It's greater than 1 centimeter. Polyp are benign growths, and polyps extend from usually they can be various formations. They can be pedunculated. Anything is pedunculated, it's like a stem-like stalk. You could now say, well, that flower is pedunculated. It has a stem on it. But you have in the intestines, they look to see if they are, have a stalk and they kind of hang, or are they sessile, so that they're flat. They attach to the base, but your picture shows the boy on page 8 and figure 8 there. You notice his right nostril is plugged. You can't see up it, whereas the one on his left side, which would be, it's on the right as you look at it, but it's the left, his left nares is open, but the right has a polyp that is protruding there. So polyps are common on mucous membranes. So that's what they are, for that term. A pustule is a small abscess, and in other words, it has pus in it. Vesicle, pimples can become pustular, but sometimes pimples, they come from various degrees of injury and progression. Okay. Vesicle is a small blister. So that's this is how you're going to be. There's matching on the test for most of these, so that you'll recognize it. A large blister is a bulla, and the plural form for bulla is bullae. Remember, words ending in A, you add an E to form the plural. So bullae are large blisters, whether you get them from burns or their allergies or you have a dermatitis. But you have an example of a good one. there on K. That's K is they're saying a vesicle is a bulla, that it should be pimple. There's the small things, but that's large. But you can get a blister that covers like the back of the hand. That is really a bulla. Ulcer is an open sore. We have decupitous ulcers, which decupita means lying down in Latin. So patients that are in these skilled care facilities or nursing homes that are unable to get up and get out and about develop these decupitous ulcers, and that's a breakdown of the tissue, so it comes wide open. You have a picture of an ulcerated lesion there on J. But you can, I've seen some really nasty decupitous. I thought a book had it, but it doesn't. There's a lot of good visuals in here for you, but it's associated. But anyway, that's an ulcer, the open sore. Wheel, we think is a smooth, slightly elevated. An example, and your test questions will give you examples. An example of a wheel is a mosquito bite. That little tiny elevated thing. Okay. Alopecia for signs and symptoms, for baldness. And you have various types of alopecia. There's alopecia areata, and I'm going to go to that page here real quick. So see the alopecia areata, in which hair falls out in patches, or you people that alopecia is where they're just generally bald. Some people, I had a neighbor that every time she's pregnant, she lost her hair. It always grew back, and then she got pregnant again, it'd fall out again, something with the hormones. But alopecia is baldness. Ecchymosis is singular. Ecchymoses, es, is the plural. And ecchymosis is a bruise. And it's an ecchymosis, and listen, this is a test question. Ecchymosis is the adjoining of petechiae, or I shouldn't say, ecchymosis is a bruise. Purpura is the merging of these. So ecchymosis is a bruise. Petechia, we have petechiae, add the E for the plural. Small pinpoint hemorrhages, we had talked about that earlier in a chapter, I think it was on the blood. But anyway, it's the bruise, it's a combination where the bruise and these small pinpoint hemorrhages merge. And then you have an example of what that looks like in your book. And I know it's in here someplace. I don't see it quite offhand, but that's the ecchymosis, bruising, petechiae, small, and purpura. That where you, as a combination, you have both ecchymosis and petechia. Just like ecchymosis and petechia get married, so they're merged together. Pruritus, P-R-U-R. So that's the itching, term for itching. We'll say pruritus ani. Ani is for anus. Well, children have what they call, the pinworms. You start seeing them scratch their rectum. It's like, that's a sign, they've picked up these little pinworms, and it goes through a family. They usually get it, sitting in the dirt. So it's the only way to identify these for the pinworm is that wait till the child goes to bed, because they come out after dark, and then you take Scotch tape, and then you tape the sticky side against the anus, and then you put it on a slide. This is what the pediatrician will have you do, and that's how then they look at it to identify it. But anyway, pruritus is itching. Urticaria is a proper name for hives. Acne can be papular, which is a solid lesion, or pustular. So it's like, I'll go through these spaces in a minute, but papular is without the pus formation, but then it can advance to a pustular eruption. And acne has various identifiers. We have blackhead, which is a clogged pore, and the medical term is comedo. Comedones is plural for blackheads. And then you have vitiligo. And vitiligo, it is more noticeable in people that have more melanocytes and darker skin, because it's like they lose that pigment in those areas. But it is associated with a certain autoimmune disease. It's a loss of pigment. And I believe I'm going to go here to, really quick, I don't see that. No, they have here up the top. It's just associated with, they're saying it's associated with conditions such as thyroiditis or hyperthyroidism and the diabetes. But vitiligo, all you need to know is vitiligo is a loss of pigment. That's all I'm going to ask you, and not all the other stuff. On the skin neoplasm, the callus we've already had, where they have the hyperplasia of the horny layer, and so we have the callus. We saying the keratoses, things that becomes the callus. And then keloid is the hypertrophied skin, and some people, when they have an incision, they're keloid formers, and so you need to tell your doctor. That to me would be, never have a facelift if you're a keloid former, because you look better without the keloid. Then they make an incision, and that scar heals by hypertrophied, excessive development of the cells trying to heal. Then you've got a keloid for all of that incision, and that's not something you want. But they do injections to try to eliminate that or prevent it from happening. I know that in derm they used to use put in like a Novocaine even. Now this is an analgesic, topical analgesic or anesthetic, and would prevent it from getting too big. But keloid is a hypertrophy thickened scar, and you certainly have some of those visuals. Nevus is the singular for the name for a mole. Nevi, plural. So you have a nevus. You have a nevus is one. A lot of moles, and it's nevi. Purulent. We've said purulent is pus filled. Purulent versus pruritus, P-R-U-R-I-T-I-S. Pruritus is itching. So there's some spelling highlights. Ichthyosis, I've already mentioned. So you have the ichthyosis is the extreme dry scale. And so then you have xeroderma is the mild form. So it's just people that just think of, as you old, your glands aren't as active, and so that's xeroderma. But ichthyo, you have that picture of the knee was just like it's thick. The skin is just thicker and coarser and cracked and very dry. Paronychia, and again you have a picture of that on page 659. Let me go to that one. We see, oh yeah, good picture. The acute paronychia, which it says most common occurs from biting, nail biting, or finger sucking, aggressive manicuring. So you can get that. Again, when you have a manicure, make sure that the salon is really safe and their instruments are sterilized. Some of them may say, "Oh yeah, this sterile," but they use it. I don't want them to soak it in any solution, because that solution, unless they're changing it every day, they're reaching in and pulling these things out, putting the dirty one. They wash it, put it in there, but it's still not. So that's which I just not good technique. Now they have microwaves, and I notice a lot of the salons now starting to microwave their utensils, so to speak, whatever the scissors and things they use. Okay. So there's the paronychia. And let's see what else says. Okay, spelling I've already mentioned. Integumentary, A-R-Y, carry. So that's base for the skin. Integumentary is the skin and the adjacent or the associated structures. Ichthyosis, the extreme dry skin. Paronychia, see that is the infection that you get around the nail. Subcutaneous, E-O-U-S, subcutaneous layer of the skin. And so a lot of the stuff you'll have matching. And so like all those lesions and colors are going to be matching. So if you play the games I created, you should ace this. Okay, so it's 30 questions in 30 minutes. So I suggest you do the homework that I posted in the Dropbox because those are the terms. It's just another application. Also, if you do the exercises at the end of the chapter, particularly when so I'm going down here, it's like C, D, E. You have F, where you can look at associate which is what, G, and that you could do H. Not all of them, but there's some on H that will help you. So the thing is, if you have your book open and you look on page F. Well, I wish they had it more than C, but you'll notice like it goes macular. I always think is flat. Think of a Mack truck. If a Mack truck ran over you, you would be flat. Okay, macular. Macular thing, we have tattoos and we have freckles. Okay. Then it goes papular. Papular is solid, but it's just a slight elevation. Okay. And then you go into a tumor, and then from tumor, so it's just various large areas. There's solid. When you go, there's nodules, which is small, less than a centimeter. Then you have the larger, the bullae. I mean, you look at those in what their appearance, then you ought to be able to get that. So I think there are there's 30 questions, and I think most of them are matching. There's some will be there's spelling like subcutaneous and integumentary and ichthyosis. I've already given you that. And the loss of skin, or loss not of skin, but loss of pigmentation in areas of the skin, as vitiligo. Then you have the small opening on the surface of the skin is a pore. Okay. Electrocautery is the use of a surgical knife to burn tissue. And measles is an example of a papule because it's it's elevated. And we go thickened scars or keloids, so that should pretty much hit it, and I expect you to ace this. Okay, so that we are finished, and I'll see you in cyberspace. Bye-bye.